Understanding Metabolic Syndrome, a comprehensive guide. Metabolic syndrome, a complex and multifaceted health condition, has garnered increasing attention in recent years due to its association with a multitude of serious health issues. In this comprehensive guide, we delve deep into the intricacies of metabolic syndrome, shedding light on its origin, classification, and the dangerous consequences it can impose on those affected. Explore our comprehensive course on metabolic syndrome. Metabolic syndrome demystified. Metabolic syndrome is not a singular disease but rather a cluster of interconnected metabolic abnormalities that significantly increase an individual's risk of heart disease, stroke, and type 2 diabetes. This condition is often diagnosed when a person presents with a combination of specific health markers. Origin and development of metabolic syndrome. The origin of metabolic syndrome can be attributed to a range of factors, including genetics, lifestyle choices, and environmental influences. While genetics can predispose individuals to this condition, lifestyle choices such as a poor diet, sedentary behavior, and excessive alcohol consumption play a pivotal role in its development. Classification of metabolic syndrome. Metabolic syndrome is diagnosed when an individual exhibits at least 3 of the following 5 key components. Abdominal obesity, excess fat accumulation around the waistline, often measured by waist circumference, is a primary indicator of metabolic syndrome. It is more than just a cosmetic concern. Abdominal obesity is linked to the development of insulin resistance. Elevated blood pressure, high blood pressure, or hypertension, is a significant risk factor for heart disease. In metabolic syndrome, blood pressure levels are consistently elevated. High blood sugar, elevated fasting blood sugar levels are indicative of impaired glucose metabolism. This condition is a precursor to type 2 diabetes. Elevated triglycerides, an increase in triglyceride levels, a type of fat in the blood, is a common feature of metabolic syndrome. High triglycerides are associated with an increased risk of cardiovascular disease. Low HDL cholesterol, high-density lipoprotein, HDL, cholesterol is often referred to as good cholesterol because it helps remove excess cholesterol from the bloodstream. In metabolic syndrome, HDL cholesterol levels are lower than desirable. Risk factors and warning signs. Understanding the risk factors and early warning signs of metabolic syndrome is essential for timely intervention and prevention. Common risk factors include age. Metabolic syndrome becomes more prevalent with age, particularly after the age of 40. Family history. A family history of metabolic syndrome, heart disease, or diabetes increases the risk of developing the condition. Obesity, excess body fat, especially around the abdomen, is a significant risk factor for metabolic syndrome. Physical inactivity, leading a sedentary lifestyle contributes to the development of metabolic syndrome. Unhealthy diet, a diet high in refined sugars, saturated fats, and processed foods is linked to metabolic syndrome. Early warning signs of metabolic syndrome may include elevated blood pressure readings during routine checkups, increased waist circumference or sudden weight gain, elevated fasting blood sugar levels, indicating impaired glucose metabolism, abnormal lipid profile, with elevated triglycerides and low HDL cholesterol. Recognizing these risk factors and early signs can prompt individuals to seek medical evaluation and make lifestyle changes to reduce their risk of metabolic syndrome. The dangerous consequences of metabolic syndrome. Metabolic syndrome isn't a benign condition. It can have severe and far-reaching consequences for affected individuals. Let's explore some of these dangerous outcomes. Real-life examples. To truly understand the impact of metabolic syndrome, let's consider 5 more real-life scenarios. John K.'s struggle. John, a 45-year-old executive, was diagnosed with metabolic syndrome after a routine health check. His sedentary lifestyle and high-stress job had led to abdominal obesity, elevated blood pressure, and high blood sugar. Shocked by the diagnosis, John realized he needed to make a change. He began incorporating regular exercise into his daily routine, such as brisk walks during breaks at work and regular gym sessions. He also adopted a balanced diet, focusing on whole foods and portion control. Over time, John saw improvements in his metabolic markers and overall health, highlighting the impact of lifestyle modifications in managing metabolic syndrome. Maria T's journey. Maria, a 55-year-old grandmother, had metabolic syndrome for years without realizing it. She suffered a heart attack that left her debilitated. It was only after her cardiac event that she was diagnosed with metabolic syndrome. Maria's story emphasizes the importance of early detection and intervention in preventing severe health complications. After her heart attack, Maria underwent cardiac rehabilitation and made significant lifestyle changes, including dietary adjustments and regular exercise, to manage her condition and reduce the risk of further cardiovascular events. Case studies and success stories. Sarah L's triumph. Sarah, a 40-year-old teacher, faced metabolic syndrome head-on. Under the guidance of healthcare professionals, she adopted a well-rounded approach to managing her condition. Sarah made dietary changes, incorporating more fiber-rich foods and reducing her consumption of processed sugars and saturated fats. She also committed to regular exercise, including cardio and strength training. Over time, Sarah successfully reversed several components of metabolic syndrome, significantly lowering her risk of heart disease and improving her overall health. James B. Road to recovery. James, a 50-year-old construction worker, battled metabolic syndrome and its consequences. His journey involved a comprehensive treatment plan that included medication for blood pressure control, weight loss through dietary modifications, and regular checkups with his healthcare provider. With dedication and professional guidance, James managed to regain his health, demonstrating that with the right approach, metabolic syndrome can be managed effectively, even in the presence of other health conditions. Frequently asked questions, FAQ. What are the common risk factors for metabolic syndrome? Metabolic syndrome is often associated with obesity, a sedentary lifestyle, poor dietary choices, genetics, and hormonal imbalances. Can metabolic syndrome be reversed or managed? Yes, metabolic syndrome can be managed and, in some cases, reversed through lifestyle changes such as a balanced diet, regular exercise, weight loss, and medication prescribed by a healthcare provider. How is metabolic syndrome diagnosed? A healthcare provider typically diagnoses metabolic syndrome based on specific criteria, including measurements of waist circumference, blood pressure, fasting blood sugar, triglyceride levels, and HDL cholesterol. What are the potential complications of untreated metabolic syndrome? Untreated metabolic syndrome can lead to serious health complications, including heart disease, stroke, type 2 diabetes, and liver disease. Is metabolic syndrome preventable? Yes, adopting a healthy lifestyle that includes regular physical activity, a balanced diet, and maintaining a healthy weight can significantly reduce the risk of developing metabolic syndrome. Explore further. For more in-depth information on managing metabolic syndrome and taking control of your health, consider enrolling in our comprehensive course on how to manage metabolic syndrome. This course provides valuable insights, practical tips, and expert guidance to help you navigate the challenges of metabolic syndrome and work towards a healthier future. In conclusion, metabolic syndrome is a complex and serious health condition that requires careful consideration and proactive management. Understanding its origins, classification, risk factors, and the dangerous consequences it can pose is crucial for early detection and prevention. By making informed choices, recognizing warning signs, and embracing a healthy lifestyle, individuals can reduce their risk of metabolic syndrome and its associated complications. Remember, your health is in your hands, and knowledge is the first step toward a healthier future. Your health matters for us. We are Quali.Health. If you want to effectively protect your health, get your all-access health pass at www.quali.health. Our health skills provide valuable information and guidance on specific health conditions.